Good vision is an essential part of living life to its fullest potential. Now imagine that good vision is not a precondition for 2.7 billion people around this world. Nearly the population of the whole of China and the whole of India around the world live without having access to a pair of glasses, which can help them correct their blurry vision. When people see clearly, they can access economic opportunities that they never knew existed before. So good vision is a building block to all aspects of what we call a good life. I'm Anurag Hans. I'm the head of mission for Essilor Luxottica and the president of the OneSight Essilor Luxottica Foundation. We are the largest foundation in the space of uncorrected refractive error, and we exist because 2.7 billion people around the world need but don't have access to a simple pair of eyeglasses, and we are working every day to make that happen. So we identified pretty early on that for us to solve the poor vision crisis, actions have to be taken and investments have to be made across 4 broad areas. The first one is that we have to create permanent access, permanent infrastructure in remote communities for vision care, for communities to be able to access vision care services on a day-to-day basis. It might be difficult to imagine that there are remote communities that have never seen what an optical center or a vision center or a pair of glasses looks like. So we actively work towards training unemployed and underemployed youth in these communities to become primary vision care providers in their own home communities.
मेरा नाम प्रेमचंद तिवारी। मैं पिछले 8 साल से आई मित्रा बनकर के चश्मे का काम कर रहा हूँ। तो उन लोगों के लिए ये वरदान हो गया है, यहाँ पर उनको ना कहीं जाना होता है, ना किसी गाड़ी का इंतज़ार करना होता है, गांव से ही सीधे आ जाते हैं दुकान पे, और मैं भी उनको यथोचित जितना मुझसे हो सकता है मैं उनकी मदद करता हूँ और नेत्र ज्योति को सुधारता हूँ। और उनके जो दैनिक जीवन में जो परेशानियाँ होती हैं, खासकर ये सिर दर्द भी हो जाता है अगर चश्मे की दृष्टि सही नहीं है, तो उन लोगों के लिए मैं बेहतर जीवन दिखा पा रहा हूँ, बता पा रहा हूँ और दे पा रहा हूँ।
मेरा नाम भागचंद पांडे है और इस बिज़नेस को मैंने 18 नवंबर 2019 को स्टार्ट किया था। लगभग 5 साल पूरे होने जा रहे हैं मुझे इस संस्था पे। और मेरे गांव में पड़ोस में एक बुजुर्ग इंसान थे, उनको काफ़ी पेन हो रहा था माइंड में। मेरे पास आए गांव से, मैंने उनका आई टेस्ट किया तो उनका काफ़ी नंबर था, जो बोला था सिलेंड्रिकल नंबर था उनका। तो सिलेंड्रिकल नंबर जो अक्सर का होता है उसमें ज़्यादा पेन होता है माइंड में। तो उनका लगभग चश्मा पहनने के बाद मैंने उनको बोला कि आप चश्मा पहनिए और कंटिन्यूस पहनना है आपको। तो चश्मा उन्होंने पहना, वो 2 घंटे बाद ही उनको रिलैक्स मिलना स्टार्ट हो गया। जो दर्द था वो एक्चुअली आंखों का ही था, बट उनको जानकारी नहीं थी। मैं उनके पास भी था तो मैंने उनको सही सलाह दे दी, तो काफ़ी उनके जीवन में परिवर्तन आया। आज जब भी मिलते काफ़ी ब्लेसिंग देते, दुआ देते कि भाई आज तेरे वजह से दर्द बंद हो गया, और उनको साफ दिखना स्टार्ट हो गया।
For the poorest of the poor, it's our responsibility to make sure that there are systematic mechanisms and programs, regular programs, available in these communities that can provide free and subsidized services to people who cannot afford. It doesn't matter how affordable you make your products, irrespective of whether they are able to afford a $5 pair of glasses or they are not able to afford, and then can come in, register and get a free pair and free services if needed. One of our long-standing partners is Sightsavers. We share the same ambition of creating a world without poor vision as fast as possible.
My name is Arand Mohanty and I'm the CEO for Sightsavers India. I'm based here in Delhi and I manage all Sightsavers India's programs in India. School Eye Health program of Sightsavers India focuses on screening all children in all the government and semi-aided schools in the rural districts. Overall, it looks like there is close to between 3 to 7% myopia amongst government school children, and then spectacles are given. this is something which is very important to Sight Service India, and this is where actually our partnership grew manifold.
The third one, which is often the most overlooked area, is the need to invest in innovation, which is custom made for these remote settings. Some examples of innovation projects that we have led and now have become industry standards are the 2.5 NVG product range, which was specifically designed keeping the BOP consumer in mind. With over 200 SKUs, we have an entire product range that can fit the needs of any of the 2.7 billion people that we into service. We developed ClickCheck, which is a non-electronic, affordable, very easy to use screening tool that makes objective refraction far easier and far more affordable.
We started this program called Rahi, which is talking about the eye health of truck drivers in the country. So we found 45% of the truck drivers need glasses. And then, 1 or 2 years down the program, we figured out that between 17 to 23% of the truck drivers are actually not collecting their glasses. So after that, we started talking to the foundation and then figured out that we can actually start R2C, the ready-to-click models in the truckers program. So in that sense, this is a big innovation that we did along the Golden Quadrilaterals and other corridors, making sure that the truckers get these glasses on the spot. This I see as a very meaningful partnership between Sight Service India and EssilorLuxottica OneSight Foundation. Primarily because the objective of these two organizations are the same, and it's all about transforming lives. So transforming the life of a school kid, transforming the life of a truck driver is something which can give you huge impact going forward.
For telerefraction, interestingly, urban optometrists can oversee refractions being done by technicians based in rural areas. I believe that this innovation itself will help solve the workforce barrier that has long plagued the vision care industry. We ran a study with a reputable eye hospital in India to compare how does telerefraction measure up against gold standard in-person refraction, and we found that the results showed a high level of conformity, showing that telerefraction could be the solution for creating mass access to vision care at a scale and speed that we have never seen in the past. Creating awareness not only amongst these 2.7 billion people, but also amongst policymakers, governments, and other corporates and foundations to prioritize vision care as a medium to create holistic impact. In 2019, we were the first to highlight the scale of the problem through our Eliminating Poor Vision in a Generation report. And we believe that it had a role to play in the WHO announcing the SPECS 2030 initiative in 2024. In the middle, the UN also adopted a resolution to make good vision a part of the SDGs adopted by all 193 member nations. So right now, this is the time that we hope to see an inflection point in the scale-up for access to vision care. Our aspirations for the OneSight EssilorLuxottica Foundation is to be a global catalyst, to drive change and to drive action. That action will come from corporates, it will come from non-profits, but most importantly, will come from governments and the people seeking vision care. And we'll make sure that we play our role in making universal vision care a basic human right, because good vision does indeed change everything.